of today, I've lost about 115 pounds. I've always struggled with weight loss. I'm only 23 years old now, so I needed to change my life before I was going to have some serious health issues. And I started out at about 285 pounds. I am 5'10", so I never guessed that I was that big, and I was almost, started at the point where I would cry because I was 300 pounds, 21-year-old female. Something came across me and I had a total mindset, and I was determined. And as of today, I've lost about 115 pounds.
A lot of patients that we see here in this practice, not all of them, but a good number of them have been through large volume weight loss, whether it be on their own through diet and exercise, or actually through a weight loss surgery. So they do come in with a lot of issues. They're happy with their weight loss, but they've actually got a lot of loose skin now that they feel like they need to get rid of.
A tummy tuck or an abdominoplasty is a means by which you can slim the lower abdomen. It was invented initially to take care of the excess skin of the abdomen below the navel and above the pubic bone. And over time it's evolved into a bigger operation that takes care of the skin above the navel as well, and now as far around as the patient and the doctor think, and sometimes all the way around.
Probably their biggest concern is general anesthesia. Lots of patients are very nerved and anxious about being put to sleep, and sometimes this is the first time they ever have been put to sleep. So we have to get them to the understanding that anesthesia is a very, very safe procedure.
At my consultation, I came and they were so helpful. And I've stayed in touch with Kara and Lori pretty much 2-3 times a week, answering my questions and setting up appointments, and they've just been great. And I have seen Dr. Jones, a few times too. He's answered questions there as well, so they've just been so helpful.
I kind of stay with them through the whole role, from the consultation, actually through surgery and recovery, so that they have a person that they can rely on and feel confident with. So you kind of build that patient coordinator role together.
A change in concept has helped me and both my partners in that when we were in medical school, we're old enough that we were taught that you maintain a distance from a patient, don't get too involved in anything else except their illness, and build a wall, an emotional wall, because you just don't want to get involved in all that other stuff. I would have to say the one thing I've learned is nothing could be further from the truth. The more I talk with the patient about other things in their life, the more I understand where they're coming from, and the more I can tailor what we're going to do to an individual, rather than go to a book, find the operation, and go do what the book says.
Watching the patients go through this transformation is absolutely incredible. It just sometimes brings tears to your eyes to see how happy they are in the end of all things. They take on a whole new lifestyle for themselves, and it's very exciting to see that.
I know I did a good job, but it feels great to know that you look great. I feel pretty darn good. I'm very happy I did the surgery. After about the week, I saw results. The swelling was going a little down, and I was very glad I decided to do it.
Our first post-op visit generally with them is 1 week after their surgery or thereabout. So sometimes we'll hear from the patients in between the surgery and that first visit, just to reassure them, make sure that they understand their healing process is typically as we expect it.
They give you a little paper in the back of the file that tells you how you'll feel basically the first week, and I think day 3 and 4 it said you were going to be regretting this surgery, which I totally was. That paper was very helpful. It helped my mom know what mood I was going to be in, because she did all my caretaking for the first week.
Probably their worst days are at the 3rd and 4th day, and that's because we get more swelling from the surgery, and so the patients don't feel as well. Generally, once they get out of that 4th day or so, they start heading to that 1 week, they're doing much, much better. Again, that emotional and physical emotion roller coaster sheet is very important, because the patients kind of looking at that during the recovery, and we really encourage that. So sometimes they still need to be reassured that this is absolutely normal. So we kind of do a lot of hand-holding during this recovery time, which is so important for the patient.
There is a lot of steps. You go through a lot of emotions. There was tears. Why did I do this? But right now, I'm 100% glad that I decided to do it.
Cosmetic surgery is a little bit different emotionally, because you can actually look at areas that you've, good things that you've accomplished, and that kind of just gives you a big pick-me-up. For most patients, that kind of gets them on their way, keeps them happy during their recovery.
Dr. Jones came in the next morning after surgery at 6:30 in the morning to make sure everything was going okay as I was laying in the hospital bed. Just little things like that mean a lot, that they really care. So it's great to know that they don't just want your money. They want to make your life a better thing.
Here in this practice, we try to treat all of our patients as if they're our own family members. If this is my mom going through this is what I would want her to know. This is exactly what I want her to feel comfort about. So I think treating your patients like they're part of your family, I think it just helps you to get through and be able to answer all of those questions and just reassure.
I could not tell you, the first thing I said was, I can see my belly button. I have not been able to see my belly button for a year, I couldn't tell you. So it's, brought tears to me and my mom's eyes, seeing my flatter stomach. So it's the step I needed to get my security back.